So the tools and techniques that we've developed to tease information out of ancient rocks turn out to be really useful also in teasing information out of the human body to understand what's going on biologically. So in particular, we're using the same mass spectrometry techniques that we've developed for the ancient Earth to look at calcium in the body. We look at variations in the isotope ratios of calcium to tell whether or not a person is gaining or losing bone mass. Turns out astronauts are a great test case for this technique because when astronauts go in space, they go weightless, and when you're weightless, you lose bone mass. It's very similar to osteoporosis and in a fairly controlled environment, so there aren't a whole lot of other variables messing around. And so we've been making measurements of calcium isotopes in astronauts, and we find that indeed isotopes shift the way we would expect if they're losing bone mass, which we know independently that they are. And so now we're in the process of trying to figure out how to apply this in clinical applications on Earth. But the potential is rather huge because with bone in particular, there are no good techniques right now for assessing whether a patient is currently undergoing bone loss or bone gain. Method of choice is an X-ray based method. It's called DEXA. And DEXA is fine, but it's telling you what happened in the past. I'll also add this is one of a whole suite of applications that are emerging. It's not just calcium, but there are other researchers working with copper, with zinc, with iron, and other transition metals and their isotopes in particular, taking these very refined techniques that we've developed for looking at the ancient Earth and the modern Earth as well, and applying them to the body. And in all cases, interesting variations appear that correlate with different sorts of disease states.